It is a very large problem with the aging veteran population. It's a very unique population because of the exposure to environmental toxins like Agent Orange and physical and emotional issues that are very specific to veterans or to military, like PTSD, post-traumatic stress disorder, and TBI. Those things we know affect cognition.
Our goal was from the beginning to find a cure, to find a treatment, to be sure that our veterans receive the absolute best state-of-the-art care. We offer treatments and research opportunities that range from the individual that have a lesion in the brain but doesn't even know it, to those that are at the final days of their life.
We are looking for people, in our case veterans, who again function normally and are at higher risk for having potentially Alzheimer's. And the way we determine it is by taking blood, looking at markers in the blood that will indicate that people may be at risk. We do genetic testing. And then we used approved treatment actually called lecanemab, or Leqembi, to try to treat patients to get rid of the risk factors in the brain called amyloid with the hope of prevention of deterioration further in life. We want to give people the comfort of having a spacious area, open, with light. People come here to do evaluations that last several hours. People come here to do infusions. The clock starts ticking since we start signing.
I'm having problems with my memory. I've been resisting doing this, but my memory problems impact my relationships with my wife, with my children, with my grandchildren. I probably should have looked for some help a few years back.
It's very important to keep an eye on it.
We'll start the program and hopefully see some improvements. If not, I'll have to sleep outside. My wife will put me out with the dog.
We don't have a dog.
Well, I didn't remember that. That's why I'm here.
So there's a full range of studies, and we are hoping to expand and collaborate nationwide with other VAs, with federal funding, and with corporate funding. And we have the ability to do it here because we're utilizing non-for-profit system.
We can bring relationships with outside funding agencies, drug companies, other federal organizations that cannot work directly with the VA. That's where we step in and we can establish those relationships and bring the VA and these other organizations together.
Why do I think that we are close to a cure? We learned that if we can decrease the amount of these lesions in the brain before it manifests as a symptom, as a memory problem, then we can transform Alzheimer's disease, which today is a fatal disease, into a chronic disease like diabetes or HIV/AIDS. A big win, something I did not believe I will see in my lifetime.